Welcome to the Human Momentum Podcast. I'm your host, Erik Schabert. I created this podcast to leverage 12 years of osteopathic medical training and over a decade of experience in primary care medicine to help sort through the confusing and often contradictory health information found on the internet. I want to distill all this information down into a form that you can use every day to optimize your health as you move forward through life. So if you are looking to get to life's finish line with the ability to do all the things that you love intact, then this podcast is for you. If this is your first time here, please don't forget to smash the subscribe button and throw us a like as well. I'd also love it if you would share this episode with people in your life who you believe can benefit from it. It really helps us get this information out to more people. With all that said, let's move on with today's episode. Welcome back to the Human Momentum Podcast. Today, I want to discuss a topic that was suggested more or less through a few comments in two separate previous videos of mine, and that is near-infrared light, the research on it, and what it suggests about potential health benefits of exposure to near-infrared light. So to begin with, I want to talk about what near-infrared light is. Light that comes to us from the sun is divided into different wavelengths. The portion of it that we're most familiar with is the visible spectrum. And these wavelengths can be broken down into different colors with wavelengths of light describing the colors. So the portion of light that is just a slightly longer wavelength than the visible spectrum is called near infrared light. And this is light that goes between about 750 to a couple thousand nanometers in wavelength. It's not important that you know the numbers, but just recognize that the wavelengths that are just a little bit longer than the red wavelength that we see is near infrared. And it has some characteristics that I think are pretty important. Number one, it has the ability to penetrate clothing in the body in ways that many other spectrums of light don't. Certainly, the ultraviolet light that is on the other side of the visible spectrum does not penetrate clothing or very deeply into the skin, but carries a lot more energy. Whereas the near infrared spectrum, it's a lot less energy, but it penetrates a lot better. Just some interesting things to know that will apply to some of the basic science I'm going to discuss in just a minute. So one of the landmark studies was published in 2019 by a couple of researchers named Scott Zimmerman and Russell Reiter. And what this research really showed was that, number one, this near-infrared light does penetrate the human body quite readily. And additionally, it has some really significant intracellular effects. The primary of these is that it does seem to stimulate production of a compound called ATP in the mitochondria, the energy factories of the cell. And ATP is what our cellular mechanisms use for energy. One of the things we see in insulin resistance is actually impaired ATP synthesis. So seeing something that through photoreceptors stimulates the production of ATP is potentially pretty clinically significant. Additionally, stimulation of photoreceptors by near-infrared light has also been shown to increase production of melatonin within cells. We've long known that melatonin production can be very important in the pineal gland of the brain, and that this production and secretion of melatonin seems to be very significant in setting our circadian rhythm and allowing us to sleep properly. Melatonin production within cells is an entirely different animal, serves a different function from what we can see, and is not involved with the circadian rhythm, and is not involved as much with, or at all, with our sleep cycles. This production of melatonin seems to be very important in responding to something called reactive oxidative stress. These compounds that come from melatonin production intracellularly definitely have antioxidant action. So they do have the potential to protect DNA from things that would damage it. And that has some obvious potential clinical applications. All right. With that research showing a lot of interesting intracellular mechanisms, we have to go on and look at some potential clinical applications. In 2021, there was a research review done that looked at previously published research in the Journal of Medical Sciences looking at treatment of near infrared light or eye issues such as myopia and treating multiple other ocular and neurologic conditions. Basically, what this review found is that these small clinical trials did indicate some potential benefit, but it wasn't conclusive. And the thought is that if these therapies are truly beneficial, it's because some of the cells in the eye are among the cells that require the most ATP to function of any cells in the human body, and that if near infrared light is stimulating ATP production, that could be beneficial in some of these eye conditions. Again, this research gave us some signal of benefit, but did not conclusively prove benefit. A December 2022 randomized clinical trial also looked at near infrared light through an artificial unit producing a specific wavelength of near infrared light at 850 nanometers and compared it to a placebo for individuals living in Northern Europe. And what they did was they took these 56 individuals in their treatment group and a similarly sized number of people who were getting the placebo treatment, and they treated them for several weeks during the winter, several weeks during the spring, the summer, and the fall. And then they evaluated a lot of things like cognition and well-being and quality of sleep and effects on circadian rhythm. And basically what they found is that these people in the study group felt better during the winter, but didn't really notice a lot of effects in the summer. And the benefits were really constrained to measures of well-being and subjective cognitive function, whereas more objective tests and questions about sleep and circadian rhythm, they didn't see much, if any, change. And in March 2023, you also had a study published in the Tanafus Journal of Respiratory Disease that was evaluating numerous studies done during the COVID-19 pandemic, looking at different kinds of photolight therapies for potential benefit in COVID-19 treatment. With regards to near infrared light, what they did find in this review is that there was a lot of mechanistic evidence for near infrared light improving antioxidant levels and ATP in immune cells, but there wasn't a great deal of clinical evidence of benefit. The handful of studies that did show benefit in treating people with serious COVID-19 illness with near infrared light showed a very limited benefit that may not have reached statistical significance in most cases. It should be noted that all of those studies were very small, and it's possible that there was a modest benefit to near infrared light therapy in these COVID-19 cases that didn't show up because the numbers treated were just too small. It's also possible that if there were follow-up, that we may see differences in rates of long COVID and other such long-term complications of COVID-19, as this was not evaluated in any of those studies. There also was another small study that looked at using near-infrared light for treatment of long COVID, but again, this was a very small study. It wasn't very well controlled, and I don't think we can draw a lot of conclusions from the results, although, again, there is potential benefit for this, especially if you consider that our suspected mechanisms for long COVID are either neurologic breakdown or immune dysfunction. And in either of those cases, there is at least potential theoretical benefit to near infrared light. Additionally, I want to mention one other study I covered in my previous video looking at autism causation. And this was a very large multi-country study done looking at the time of gestation for infants and how gestating during the winter months versus having a gestation period during the summer months affected risk of developing ADHD and autism spectrum disorder as a child. And it turns out that there was substantial signal that for women who were pregnant and living in more extreme northern or extreme southern latitudes, that there did, in many countries, seem to be a lower rate of autism spectrum disorder and ADHD in children that gestated over the warmer months with longer days than women whose children were gestating during the winter months. This wasn't 100% consistent across every country. There were a few outlier countries, and the signal here was not strong enough that we could draw any causative conclusions. So it's interesting, and it's certainly something that we could continue to study and potentially get a little bit more information that this could possibly be playing into causing the increasing rates of autism that we've seen over the past 50 years or so. In any case, what we have here is a lot of mechanistic data without a lot of clinical data that proves that our mechanistic data shows up as clinically important. And I think where this leaves us is with a situation where it's tough to make a universal recommendation for near infrared light therapy, and certainly not for investing money to purchase a unit where you can do near infrared treatment in the home. However, we're also left with the knowledge that it is fairly easy to get near infrared light exposure without any potential harm. All it takes is going outside for 30 minutes, 45 minutes, during the first 2 to 3 hours the sun is up, or the final 2 hours or so before it sets, and we can get plenty of near infrared light without an excessive risk of ultraviolet B exposure that could lead to sunburn, skin damage, and increased risk of cancer. So there is a potential, I guess, therapeutic thing to pursue. Also, if you're pregnant and you are concerned about a family history of autism spectrum disorder, it certainly wouldn't hurt to make a point of getting outside a little bit as long as the weather isn't too prohibitively cold, and getting a little extra sunshine on your face to potentially help with prevention of autism. I can't say conclusively, and no one can, that sun exposure is going to prevent a case of autism, but there is some reason to think that maybe it helps. And for something that's so easy to do, it probably makes a degree of sense. So this is something that I think we, as a medical community, need to keep an eye on and see if there is potential for near infrared therapies to be an effective intervention for multiple disease states. And I think if you're suffering from some kind of autoimmune disorder and you're having trouble dealing with it for any reason, that adding a little bit of sun exposure is potentially helpful in those cases, and certainly is something that you can pursue that doesn't have a lot of downside and has some significant potential upside. Just make sure that you are protecting yourself from ultraviolet B radiation, mainly through just not having too long an exposure during the midpoints of the day. I think that's all I have to discuss on this topic. I wish there was a little bit more definitive information out there. There just isn't. I'm going to link all of the studies I mentioned in this video in the description. So if any of you are interested, you can read the research yourself. I don't think there's a lot there that's going to jump out and say anything that I haven't said, but feel free to correct me in the comments section if I'm wrong. And if you have additional questions, feel free to fire away in the comments section. If you can, go ahead and drop me a like and subscribe, as it's very helpful for me to continue to put out this kind of content. And in any case, you all have a great and happy holiday, and I'll see you next time.